In this video, I will be taking you through the Corporate Health and Wellness online wellness portal. For this demonstration, I will be going through this demo as user Jen. Jen is already an existing member, which means she's already completed her health assessment, she's already in the middle of an incentive campaign, she already has information up top for her to use, as well as down the sides and in the middle on the rotator as well. So she's well on her way for all the items she needs to accomplish within her portal. What we're going to do for this demonstration is click through some of the tools that Jen has available to her. Then we're going to take a step back and see how Jen got here, because Jen did not start off with all this information within her portal. We were able to sequentially deploy information to Jen based on her needs and her risks in a manner that could build off her successes and make her portal use easier to use. Across the top, Jen has an image slider that she can use. Here she can click on items like sports nutrition, her meal planner, her workout tools. She can activate her smartphone, and she can message a personal trainer as well. Going down the page, Jen has another content management system right in the middle of her homepage, where she can read an article, make sure she's drinking enough water, log her food, manage her weight, and track her exercise. Down the left side, she has other navigation tools that allows her to easily find different areas of the portal. For example, Jen has a high risk of nutrition. The nutrition tools allows Jen to click on the nutrition tools and go directly into all the nutrition tools that we have available, including a meal planner, a food log, or even different diets for different health and diseases. Let's look at the food log a little bit deeper. As we mentioned before, Jen has a high risk of nutrition, so the food log is a great tool to help her manage that problem. For example, Jen loves Starbucks. So before she got going on the portal, she came in here and logged Starbucks, found her favorite drink, hit information, and was able to see that the drink she likes at Starbucks is 420 calories and 36 grams of fat, which may not be the best choice for her nutritional risk. So after a quick talk with her barista, she was able to see that a soy latte might be a better choice at 170 calories and 0 grams of fat. So Jen now can click on it and log it, and now that item has hit her calorie log. We can see that she's got 170 calories consumed for a 1500 recommended amount, so she has 1330 remaining. Jen has actually taken her nutritional risk to the next level and is enrolled in a meal plan. What a meal plan does is it lays out, meal by meal, different items that Jen should be eating. Jen right now is on a 14 to 1600 calorie, no restriction diet. So Jen can come down here and see all the items that she has for breakfast with her food log, as well as food that she logged outside her normal plan. Jen can customize this even farther. Let's say that Jen doesn't like grapefruit. Jen can come into the grapefruit, hit the drop down, and choose another food that's around the same caloric value. This allows Jen to customize this based on exactly what she likes to eat, so she's more likely to follow it. Jen can also come in here, print her shopping list, choose the days that she wants to shop, and generate a list that she can either email to herself or just print from here. Once Jen has all these items, she can easily click on the breakfast and log all the breakfast items to her food log. She can do the same thing for morning snack. And if for lunch she just had the hummus and the tortillas, she can just check those two items as only eating those items as well. If Jen goes back to her dashboard, on the right hand side here, we can see that under her health snapshot widget, her calories have been logging every step of the way. Jen can also log her exercise directly from this left-hand navigation. She can click on Exercise tool, and she'll go directly into our cardio log. Similar to Jen's meal plan, Jen is enrolled in an exercise plan. This plan allows Jen to have a step-by-step setup plan for her to work out and the durations that she needs to do it as well. But if Jen deviates from this plan, she can easily choose from the drop-down any type of exercise that she's done, enter in the minutes, and hit Add Exercise. She will automatically earn points if she's enrolled in an incentive campaign. And if we go down here, we can see all the exercise that she has logged, as well as the calories burned according to her physical activity level. Jen also has a couple of other tools, such as a fruit and vegetable tracker, where she can quickly and easily log all the vegetables and fruit that she eats during the day, and this automatically integrates in real time with our food log. She also has a water tracker that allows her to quickly and easily log the water that she's drinking throughout the day, and this again will connect automatically with the food log. She's got content to read based on her own personal risks, as well as a daily tip that will automatically change every time she logs in. Next, let's discuss the incentive program. Jen is currently enrolled in an incentive program within this campaign. She currently has 308 points, well past the 250 points for a paid day off. Jen is ultimately working up for 500 points to earn this free iPad. If Jen wanted to redeem for the paid day off, she could hit the redeem button, check the box, and redeem the award. The points will automatically be decremented from her account, and she could go back to earning points, hopefully maybe to earn that iPad towards the end of the campaign. Jen can click on details, and she can see a better summary of the incentive campaign. She can see that she can earn 2 points a week for logging weight, 2 points daily for logging food, 2 points daily for logging fruits and vegetables, but at least by 2 servings, 1 point daily for every 8 ounces of water she logged, 5 points for logging her exercise, which we saw when she entered in that walk, 2 points for strength training, and 2 points for walking. She can directly click on them and log points accordingly. So if she actually has some steps that she logged, she can click on walking logged and she'll go directly to the steps log, where she can enter in her steps and get her points accordingly. So Jen has a lot of items available to her, but let's take a step back and see how Jen got here. Jen did not start with all this information. One of the first things that Jen did when she came into the portal for the first time is take her health risk assessment. Our health risk assessment is NCQA certified. It's written at a 7th grade reading level. It takes about 15 minutes to complete. Our health assessment is indexed off of both gender and age, meaning that for Jen, when she goes to preventative health, she's going to only be asked questions that are pertinent to her gender and her age. So Jen went through and answered all the questions, from her health view and preventative health, to her nutrition and exercise habits, emotional stress and safety, tobacco and alcohol, readiness to change, and even a few questions on productivity and culture in her workplace. Once she's all done, she then gets categorized and pushed into our risk advisor. Our risk advisor allows us to stratify Jen's risk and appropriately allow her to take action. As noted before, Jen has a risk on nutrition. So this risk has came up after she's taken her health assessment. Jen has additional resources here about eating a diet low in fat, eating a diet rich in fruits and vegetables, how to eat healthy, and how to watch her salt intake. She also has a learn more here that goes a little bit in depth on healthy eating. There's a good chance that Jen has seen all this information before. What Jen needs is to take action on this risk in a way that we can sequentially deploy different items that build off successes week after week. So if Jen clicks Take Action Now, she has the option of enrolling in 2 of our online workshops, nutrition and exercise. If she clicks on nutrition, she's automatically enrolled in the nutrition workshop. If she hits close and goes back to her dashboard, she now has a to-do list on the center of her dashboard with different items that she needs to accomplish in order to start taking control of her nutrition risk. The first task is to learn about nutrition basics. This is a PDF that she can print out or just read and close at her convenience. Where this was really powerful for Jen is that in the first week she was in the portal, After taking her health assessment and classifying her as a high risk for nutrition, we were able to present a personal food log in a paper form in week 1. Jen can print this out and write down everything that she ate from day to day and see her eating habits on paper. This is nice because we do have a very robust food log and a meal planner, but there's a good chance that Jen, when she first gets started, won't know how to use it. After she completes week 1 and utilizes this paper food log, week 2 we told Jen to use the food log, but just log her breakfast. That's when she noticed that her favorite drink at Starbucks may not be her best choice. Then week 3 came along and we had her log a complete day. And then it wasn't until week 4 that we were able to introduce the meal planner and start having her take even bigger actions on conquering her nutrition risk. This was simply due to the fact that we were able to classify her in as a high risk for nutrition simply by virtue of taking her health assessment, and then sequentially deploy week by week, making sure she was successful, different tasks for her to complete to get used to the portal as she goes along. And then, of course, Jen can always see her health assessment report. She can get a view of all of her risk. She can see her wellness score. The wellness score is from 1 to 100, 100 being the perfectly healthy score that we're all after. She can see her incentive points, and she can see all of the information from all of her risks down in a graph as well. She could then print this report, print her health summary, or even view her screening results as well. The Wellness Portal has quite a few other tools that we can use to make sure Jen is engaged within the portal. For a more in-depth demonstration, please contact us, and we will be happy to show you a deeper dive of our Wellness Portal. Thank you for watching.